Hi, I'm Prue Andrus. I'm the academic lead for simulation in the Bachelor of Nursing at Murdoch University, and I look after all the learning opportunities that the students have when they're in the simulated labs. We create opportunities for the students to practice skills that they'll need when they go out on placement to practice as nursing. I started nursing when I was 17 years old. I just saw it as a great opportunity, but I think really at 17 you don't have much of a clue about nursing. It just, I don't know, it sounds stupid. It seemed like a good idea at the time, but I think when I went to uni and started to learn about nursing and started doing clinical placements and practicing nursing, that's when the penny dropped and I realised that I loved it, and that was a long time ago, and I've been nursing my whole life and working through lots of different areas, and that's the other thing I love about nursing. I've worked in operating theatres, I've worked in occupational health, I was in the army for many years, and I've just always been drawn to active areas where anything can happen. I've had a love and a passion for teaching throughout my whole life, and it just comes natural because nursing is all about teaching. We're constantly teaching our patients how to care for themselves, and it's just a natural flow on from there that you teach student nurses when they come into the clinical areas, you're teaching your colleagues. So teaching came very natural to me, and I love being here and able to help build up that next generation of nurses that are going out into clinical placements right now and making a difference. Our nursing sim suites have been specifically built for the student nurses to be able to mimic reality, so that from the day one, week one of when the students start nursing, they're coming into these suites, they're dressing in uniform, they're learning fundamental skills that they're going to be using when they're on placement. The suites are all about creating and mimicking reality, so our students can practice skills, and then when they transfer those skills into clinical placement when they go on placement. Our students start going on placements from first year and across all semesters of their degree. So it's important that they can come into the university, practice skills, learn skills, and then go out and do those skills on patients. Everything we do here in the clinical labs is all about preparing our students. The documentation that the students come across at the bedside is actual documentation that they will see when they're on a clinical placement. We work really closely with hospitals, so with our large tertiary hospitals here in Western Australia, so that the students, when they're practicing skills here, will be practicing exactly the same skills when they're on placement. Nursing can be quite complex. For example, when students are on a placement in a hospital, they'll need to go into a treatment room and to be able to choose between a variety of different medications that are available. So right here in the labs, when the students are first starting to learn about medication administration, we have a pharmacy set up. So the students will take the medication chart, they'll go to our little pharmacy, and then they'll go and choose the correct medication that they're requiring for the patient, just as they would on placement. So we're trying to develop that complex thinking, that critical thinking, right from day one when the students come here, because we know that when they're on placement, they'll need to be able to transfer these skills. So our students learning how to critically think and make decisions right from day one really gives them the edge when they get onto placement, because they're already thinking about different options and opportunities that they need to be able to decide to make the right decision for their patient. We think that's really important for them. Today in the simulation suites, the first year students were learning all about neurovascular assessments. So in this simulation, what the students were doing, one student would role play being a patient, and the other student would have to conduct a neurovascular assessment of the lower limb. So that would involve taking pulses of the feet. So they learn how to take pulses of the feet, the dorsalis pedis and posterior tibialis pulses. They also have to look at the colour, warmth, movement and sensation of the feet to be able to determine if there is good circulation and sensation to the lower extremity. This is helpful for when the students go on placement and they may be working, for example, on an orthopaedic ward where somebody may have a cast on their leg or have had surgery to their knee, and they'll need to be able to undertake this sort of an assessment on that orthopaedic patient. In the simulation suites, we use a wide variety of mannequins. Some of our mannequins are very low fidelity, almost like a doll. Other mannequins are very high functioning technologies. They basically have about 3 different laptop computers in their abdomens, and this allows for the students to have a real experience with delivering skills to the mannequins. For example, our mannequins can talk, their pupils can dilate and constrict, their throats can constrict, we can tube them, we can put different airways in them, we can cannulate them with intravenous fluids, we can give them medications. They also have a wide range of microphones. They also have a wide variety of speakers in their chest and their abdomen to mimic sounds. So for example, if we're wanting to create a patient with asthma, then we can dial up different asthma sounds in the patient's chest so that when the students are placing their stethoscopes on the chest, they can hear asthma as opposed to crackles or as opposed to a stridor, these different sounds, or pneumonia that they would hear in the chest. Likewise, the students are able to take blood pressures. We can manipulate and dial up different blood pressures on the mannequin. For example, a patient that is in hypovolemic shock may have a very low blood pressure. So if that was the scenario that the students were looking after, a patient in hypovolemic shock, we would dial up a very low blood pressure and a weak 3D pulse. So when the students are undertaking a set of observations on the mannequin, it's very lifelike. In our Bachelor of Nursing, we have over 800 hours of clinical placement that the students must attend and we record. The simulation labs are in addition to this. So when the students come here across the whole 3 years of their degree, that's not part of their clinical placement. Rather, the wards here prepare students for placement. So the students will learn all the skills and undertake all the different assessments that they would need to on placement here in the labs. And then in addition to that, they have over 800 hours of placement across various different facilities within Western Australia and the world. I consider it a huge privilege to be able to witness the growth and development of students across the 3 years. It's so awesome when you see them coming in first year, really nervous about even a basic thing, just as hand washing or taking a set of vitals like a temperature pulse and blood pressure. And you're able to watch the students progress across the 3 years, and by the end of it, they're so ready to become registered nurses. Watching the students in third year undertake large assessments on the A to E assessment, looking at airway, breathing, circulation, disability exposure in an intense simulated environment, and they do so well. They punch out everything they need to do to be able to be a really strong, safe, registered nurse, and it's an incredible privilege to watch that progression. Yeah, I love it.